dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunitz, and today our topic is integrative medicine and its effectiveness in the pediatric care. And my guest today will be Dr. Hand, who graduated from Chicago College of Osteopathic Medicine in 1989. He did his pediatric residency and chief residency at Maine Medical Center. Dr. Hand then completed his fellowship in pediatric nephrology at Children's Hospital in Boston. Subsequently, he developed the Pediatric Nephrology Division at the Barbara Bush Children's Hospital at Maine Medical Center. In 2008, he graduated from Dr. Andrew Weil's Fellowship in Integrative Medicine at the University of Arizona and created the Pediatric Integrative Medicine Division at Maine Medical Center. In 2011, Dr. Hand was hired by New Hampshire's Hospital for Children at the Elliott Hospital to develop the Pediatric Nephrology Division and to create a children's hospital with integrative medicine at its cornerstone. He has been featured in a number of international television shows, including 2020, the Discovery Channel, and the Oprah Winfrey Show. Dr. Hand, I am so delighted that you are here with us today, and welcome to the Health View.
Thanks, Yvonne. I'm really looking forward to this.
Yeah, and I know that here you are a pediatric nephrologist. Mm-hmm. So for our audience, why don't we start with there? Mm-hmm. What does a pediatric nephrologist do?
A pediatric nephrologist takes care of children with kidney problems. Nephrology means kidney, and it can be anything from kidney failure to chronic kidney disease, kidney transplantation, dialysis, kidney stones, blood in the urine, just about anything, urinary tract infections. And that's what a pediatric nephrologist does. I have been doing this for a while now,
yes.
And I got interested in the concepts of integrative care in the early 2000s, and that's what led me down the path of integrative medicine.
Now, you have been truly a leader in this, and you have a tremendous passion in it. So, and I know that you did your training with Dr. Andrew Weil, who's known in this field.
Right.
And it's really developed a great reputation regarding it. And what made you go into this, and what is the meaningfulness for you?
Yeah, it's a great question, because I was, as a pediatric nephrologist, when I was doing my fellowship down at Children's, I was putting 2 electrode voltage clamps into xenopus oocytes, which are toad eggs, and looking at what are called the anion channels. This was my research, and it's a far cry from doing integrative care. I ended up getting sick, actually. In 97, 96, I came out of the fellowship, and I started the program up in Maine. And I was working a lot of hours. Did about 2 straight years of pretty much continuously being on call and seeing kids in Maine and New Hampshire with kidney issues. I sort of inherited a lot of the children that were traveling down to Boston, because at the time there weren't any pediatric nephrologists that were practicing in Maine or New Hampshire. So I went back, started the program, and was very busy. I flew out to a conference to give a talk at a transplant meeting in Chicago. I laid down to take a nap, and I woke up, and my whole body was completely frozen. Oh. I couldn't move my back, I couldn't move my shoulders, my neck,
scary.
And I had terrible arthritis. What I didn't realize was that I'm genetically predisposed. I have a condition called, it's HLA-B27 positive. It's a genetic predisposition towards an arthritis. So I was on medicines for a while. I was really laid up. I gained a lot of weight. I was feeling really crummy. The medicines made me feel awful. And I was trying to decide, well, how do I get myself better? And I really thought I gotta make some changes in my life. And I started doing some gentle exercise. I started changing my diet. I started doing more relaxation techniques and things to help heal myself. And 3 months later, I was better. And this was in the late 90s. And this was when integrative medicine was really just coming into the forefront. It was really in its infancy stage. So I'm stuck with this sort of internal dilemma, I guess you would say. How do I deal with the fact that I know this helped me, but I wasn't teaching my patients about it? And I wasn't teaching my colleagues about it. And I always say external dilemmas or external conflicts are hard, but internal conflicts are really hard. And so I said, well, I need to do something about this. And it just so happened a friend of mine who was a family practice resident under me, he'd come back from Maine, he had just spent 2 years out with Dr. Weil's program, and I called him and I said, Craig, how do I do this? And he says, just go do it. And I was like, well, it's a little easier said than done. And I got the money for the tuition and went out and did the fellowship, and it's a 2-year program. But that's what got me into it. And I really, at that point, thought about it and said, we have to change healthcare. We can no longer just be passing out medications. We can no longer be not addressing the bigger issues of how patients should be cared for. And that was the start of sort of a long journey.
Which is very interesting because they say that some of the biggest changes occur based upon what it had affected the individual.
Yes.
Right? If something changes an individual or necessitates an individual to change or to seek something in order to get the answer to help them, be it in their health and well-being or whatever, that's the mark of the beginning of the change.
Exactly, and you see this in all the people that I talk to. There is usually an event in their life or an event in their family's life or something that changed how they view whatever it may be, in this case healthcare, and it leads them down a path that is, in my case, it was healing, and for patients it's healing. I also came to this realization during all of this that the concept of integrative care, also sometimes known as complementary and alternative medicine, that's a little bit of an older term for it now, didn't give up Western medicine. It's sort of a misnomer. People think that it's, well, you're not really practicing medicine. I take care of very sick kids with kidney transplants and dialysis, and they need medicines, and medicines have saved their lives. It's changed, Western medicine as we know it has changed the whole landscape of medicine. So we can't ignore that. We have to be good at that. But we can then incorporate that into what we're doing. And interestingly, at the time, integrative care was viewed more as a wellness thing for well people. So essentially, you might do some yoga or you ate well and you went to your primary care doc and you talked a little bit about wellness, but it wasn't really geared that way in the ill population. So if you stepped out and said, well, let's say a patient comes to me and says they have kidney problems, then we would almost universally put them on blood pressure medicines for their hypertension, as opposed to talking to them about other ways to control their blood pressure. And I realized in all this that the most important group of patients we can bring integrative care to is actually the patients who've been diagnosed with something. And we ignored that in Western medicine. And having said that, the patients didn't ignore it. The patients recognized it, and the patients said, we're going to do this. And I think that's the unique aspect of integrative care. Integrative care was not started by doctors, okay? Doctors probably would prefer not to have addressed this because none of us are really, or were really trained in it. This was really started by patients. Patients said—
It was consumer-driven.
Exactly. It was patients,
without a doubt.
the patients saying, this is what we're going to do, and you can sort of come along or not.
And a lot of them doing it on their own and their doctors not even realizing it because they couldn't get the answers nor feel better related to the current care that they were getting.
And it's sort of the funny part to all of this is you see something on TV and it'll say, try this, but go talk to your healthcare professional. And I laugh and I go, your healthcare professional knows nothing about it. Why would you talk to them about it? And the patients were really struggling with this, and they were doing it on their own. And the numbers of patients, including children, that are using some form of integrative care is off the chart now. And I think that's my job, is to not only to practice it in my own practice, but bring it to the greater medical population. And that's really what I do.
And when you say that it's off the chart, what do you mean by that, off the chart? Because you're dealing with, which I love, you're dealing with the most innocent, the young and vulnerable.
Yes.
And here you're bringing these creative, important, integrative modalities into the hospital and into the environment where it's easily accessible.
Yes.
and can make a difference. So let's talk about what are the things that you've brought forth.
Great. Well, there's two parts to that. I mean, first of all, how many patients are doing all of
Right.
this stuff, which is huge, and second is what are the technical modalities that we're talking about. That's how we sort of refer to them.
Exactly.
The first modality is conventional medicine. Okay, we can't throw that one away.
No, we can't.
And whenever I go out and talk, and I think this is what brings some of the credibility to it, is that I talk a lot about using conventional medicine and how conventional medicine is incorporated into what you do. It's the reason why Dr. Weil's program would only let you go into this after you had become a physician and almost universally had gotten to a level of an attending and not just a medical student or what have you. Because they recognized that you had to have a basic knowledge of medicine that was important in order to actually do integrative care.
In a sense, having the basis of the wisdom to understand how to weave this together
Exactly.
for a sense of wholeness and the best possible care for an individual.
Exactly. So conventional medicine is I always put that whenever I give a talk. It's on top line of my modalities. But the second is nutrition, and we think of nutrition, and we think physicians and people, nurse practitioners, what have you, are trained in nutrition. And the reality is, we're trained in it as a biochemistry, basically. How many calories are metabolized per gram of different things, of carbohydrates and lipids and that. But the reality to it is that's not what nutrition is. Nutrition is, how does food heal you? That's really
Food
the
is
essence
good medicine.
Exactly. And how do we bring that food into patients' care in a way that heals them? It's not something that we're taught in medical school 99% of the time. And it really makes people uncomfortable when they have to start discussing things that they're not taught. So that's one of the things that we put way up on the list, is how do you bring nutrition into patients' lives in a healing manner? The next is exercise. And exercise, we have to get away from the concept of it being, six-pack abs or, guns or whatever. We have to get rid of the concept that it is all about looks and getting your heart rate to a certain number. If you're a young person who has arthritis, or an old person like me that had arthritis, I couldn't walk 10,000 steps. There's no way I could do that every day. My joints were too sore. But I could ride a bike for a little bit, and I could take back control of my life, and I could do it with a calming, stress-reducing aspect of the exercise, something that we commonly miss. And so exercise should be targeted, again, with a healing intent. The third are supplements and herbs, and that's what everybody thinks they're coming to me for. They think, oh, I want to get off my Concerta or my Adderall, or I want to stop taking my Remicade for my inflammatory bowel disease. I'm going to go to Matt, and he's going to give me, an herb or a supplement. It is a modality, and they are very good, and they help a lot. But it is only a modality. So I want people to understand that this is not alternative. It's not just saying, okay, come in and I'm going to give you fish oil and everything's going to be better, but rather it's a piece of what we do, just like our Western medicine is, just like what our exercise and nutrition is. There are whole systems like traditional Chinese medicine, which includes acupuncture and herbs and supplements and Tai Chi. There is the Qigong. There's Ayurvedic medicine from India, which again includes things like yoga and herbs and a different way of looking at your health. There is homeopathy, which is a completely different view of how medicine should be done, which is done more in Europe than it is in the United States, but is commonly practiced. The beautiful things are things like mind-body therapies, relaxation techniques, guided imagery, biofeedback. Biofeedback is very similar to using other mind-body therapies. You just can see it on the computer. That's why people like it.
Then you have your energy therapies.
You have energy therapies, so Reiki,
touch
healing touch,
therapy,
exactly.
like that.
Manual medicine, osteopathic manipulation, chiropractic, creative art therapy, pet therapy. And one that commonly gets mixed is the concept of spirituality. This is one that is fascinating to me, because if you look at a number of the studies out there, in many of the patients who have chronic or potentially terminal illnesses, spirituality is listed as one of the top things that they view in terms of their medical care.
It's very important.
and yet doctors don't ask about it, and we're afraid to ask
And
about it.
that may be because they may not be comfortable with that.
Exactly.
Because there's
exactly.
nothing in your training related to spirituality.
Very little,
Very
and
little,
yeah,
you
and,
know, when
and certainly
you
not
think
how to
about it.
talk about it.
Right.
And
Because it comes down to the meaning of life and one's choices
yes.
in life and how we
Yes.
want to spend our life. And,
Yes, exactly.
Yeah, and for children, I would say that you're dealing with both the child as well as the adults around them, the
Yes.
family.
Well, and I think the other part included in that, in the spirituality concept, is there may be things that patients don't want to do because of their spiritual beliefs.
Exactly.
So certain religions, for example, don't want to use certain mind-body therapies
Surely.
or some Asian medicine. So you have to be very sensitive on all of these.
And there's a difference between religion and spirituality,
Exactly.
too.
Yes.
So,
Yeah.
and that's an important thing to note, and it's a sensitive thing, but must be always honored.
Yeah, yeah, and I think the more open we are about this, the more the
Absolutely.
discussions we have, the better you get as a bond with that patient.
Absolutely.
And that's really critical.
Very much so, because
Yeah.
you're really treating the whole person.
Yes.
And when you talk about integrative,
That's what it is. It is. When people say to me, well, what is integrative medicine? I say, well, it's everything. It really is everything. And I know it sounds like I'm blowing it out of proportion.
No, you're not.
But it could be my dog Omar, my bulldog, who
Right.
comes to the office with
Right,
me, and
yeah.
he sits when the kids are having their labs drawn,
Yes,
or
and pet therapy,
pet
that
therapy.
is such a music
Yes.
therapy and sound and vibrational therapy.
Doing drawings in the room,
Right.
whatever it is that helps in the healing process.
Exactly.
And I think that's the essence. You know, the dirty little secret in medicine is we don't cure a lot of things. We think of curing things, but the fact is most of the conditions out there we don't cure. And even if we do cure them, sometimes the things we do actually put people at risk in the future. And so my job as an integrative doc is really to look at the healing nature of it. So if someone comes in, let's say it's one of my kidney patients who's on a medicine, and that medicine, like a prednisone, that doesn't allow them to sleep at night, or is making them very anxious, or maybe upsets their stomach, or is impacting their joints. What can I do, not necessarily to fix their underlying kidney condition from an integrative standpoint, but take care of all of those other pieces around them?
So you're talking about their quality of care.
The quality of life, the quality, and what they do. And I always say, you know, my patients joke with me. They always say, Matt, you don't talk about my kidneys. And I say, well, your kidneys are the easy part, okay?
Because that's not who they are.
Yes, exactly. I say my job is to get you to become 75 and president of the United States, or whatever it is you're supposed to be in this world. That's really what my job is.
Fulfill their purpose in the best possible way.
And that's the hardest part.
It is the hardest.
But it's what everybody's looking for. And we started talking a little bit about the prevalence of this. In the adult population, the data is actually quite well known on this. Somewhere between 40 and 60+% of all adult patients are using some form of integrative care.
And that's from the population that's telling you.
Correct.
So they
yes.
say for those that haven't reported back, there's even
it
more.
couldn't be more, exactly. And if you take people who have a chronic illness or something that's staying with them for a prolonged period of time, the data is pretty clear. It's anywhere between 50 and up to 85% of people are using some form of integrative
various
care.
modalities to help them with their health and well-being and the
Exactly.
quality of their life and their care.
Exactly.
Now, go ahead.
Well, I was going to say in kids,
Yes.
the numbers for the chronic illness is about the same. So it's 50 to 80+%. In the well child visits, so if you went into just a regular well child clinic, the numbers can be anywhere from 15% to up to 30%. So it's still a big chunk of children that are using these kinds of things. And I always say, if your patients are walking into your office and 60% of them have hypertension, you would learn about it. If 50% of them had diabetes, you would learn about it. If 50% of them had, inflammatory bowel disease, you'd learn about it. Well, patients are coming in with these modalities. We have to get the word out. We have to get physicians and nurse practitioners and everyone understanding. You don't have to become an integrative doc, but you have to be able to talk about it, recognize it, not be judgmental when people are talking with you about it, and see how these healing modalities can be brought into patients' care.
And with that knowledge, the ability to refer, to be able to say, okay, what are the ways that we can look at this, and how can we support you through this? Now, this is the challenge, I'm sure, from your end, being a leader in this. What are the challenges, and what are the most important reasons why other healthcare professionals and people need to realize that this integrative approach is critically important in moving forward in medical care?
Well, here's the the challenges are enormous, really. And if I can just take a step back for a second and say, there's been a big battle between the concepts of Western medicine and conventional medicine, and what has been considered to be complementary and alternative medicine.
This is very true.
And they feel there is this huge rift between the two groups, and that there's no way that this rift can be, or this cavern can be crossed, if you will.
And one of the reasons we're together is to help make
And that's what we're trying to do.
Exactly.
Yes. And I actually don't think it's that big of a gap.
I don't think so either.
I think that people create the gap because of the lack of understanding about how to actually get to the place that we need to get to. So for example, when I go give a talk on this, and I'm talking to Western docs, and I say, do you believe nutrition is important in your health? Do you believe exercise is important in your health? Do you believe stress reduction is important in yours and your patient's health? And they all nod and say, yes, of course it is. It's almost like so common sense, it's ridiculous. And I say, then you're an integrative doc, because those are the essence, really the three principal things of integrative care. So you're not that far off from in the Western therapies. And people on the alternative or complementary side of it would say, well, of course it's important to have Western therapies in your. So we're not really as far off as we think we are.
If we were all to focus on what's best for the patient or the client,
correct,
there wouldn't be any rift at all.
There would be no rift.
Because you would keep yourself well-versed about all of the different modalities out there and be open to saying, okay, let's creatively and integratively look at a team approach to help you in your health and well-being.
And I think the biggest problem we have is that we have extremes on either side. And the extremes on either side keep pulling the world apart. And that's where we have the problem. The people on the Western side who feel, well, you know, I know people who've done this for this condition and the patient didn't do well. And I know people on the alternative side who say, yeah, but we never want to use these things because they always do bad, or, you know, we shouldn't have any vaccines in our children. Or the zealots and the extremists on either side are creating this rift. The other hard part to it is there's a general belief that the integrative component of this is really, and I don't want to say it's for the affluent, but that because a lot of it has to be or has been paid out of pocket over time, it's been felt to be really more of a concierge type service. That, you know, you can, if you want to go get your acupuncture, if you want to buy your supplements, or if you want to go get manipulation or whatever, that you're going to be paying more out of pocket, and that people who are dealing with patients who are on the less affluent side of it, maybe dealing with Medicaid or don't have as much money and can't, you only have $10 in their pocket. If they only have $10 in their pocket, they can't afford to go out and buy an expensive supplement or herb or whatever. So there's been this separation where the thought is, well, if I'm going to do this, I'm going to do it in a separate integrative center that is a private pay kind of thing, versus on the other side, somebody working out of a community clinic who's like, listen, how do I do this within my population? That's my job. My job is to get people to understand there are ways to do this that don't cost a lot of money, that are cost effective, that improve patients' health, and ultimately decrease
the cost
healthcare
of medical
costs.
care.
Exactly.
Yeah, that's very true. And a lot of the insurance carriers haven't covered a number of these things. And the cost effectiveness and the quality of care, we do see that there's a tremendous difference. So there's the bugaboo and the challenge, isn't it?
It's trying to get, well, and I think there, you know, it's a dilemma. It's a huge dilemma in that regard, because the healthcare, the insurance carriers have been getting more pressure from patients to cover these things.
And the patients need to express this to their carriers, to say this is important, it works, it helps me, it makes me better. And a lot of times they're not having to spend as much as some of the other things that they do in the traditional sense.
And we know that for the most part, there's a general view out there, and I say this, and I have to be a little careful on how I say it, that the healthcare system is broken. You hear that term all the time. You know, that the United States has a terrible healthcare system and the healthcare system is broken. We have some of the greatest healthcare that can be delivered in the United States.
Compare it to the whole world, we have so many things.
There's no question on that.
But the cost related to the things is an issue, and there are abuses related to it too. And I think that we, as wonderful and as advanced as we are in the area of integrative medicine and really looking at the patient first or the client first, that is an area we can do better at. And then in the end, we'll provide better care for everybody and it would be more cost effective.
Correct. And that's what I think that's ultimately where it's going, is how can, if, you know, there have been studies, for example, that have looked at patients who've had osteopathic manipulation for their headaches.
Right.
And they have found that they can reduce their healthcare costs by as much as 40 to 50%, which is terrific, okay? If they're getting some kind of manual therapy, they don't have to pay as much for their medications or ER visits and what have you, if it's helpful. There are mind-body therapy programs that have shown they've been able to improve healthcare costs by relaxing patients and helping them control their pain better. So there's more and more and more of this that's coming out. And so my goal is to create what I refer to as a value and volume model. And you may have heard me say this before.
Well, go ahead.
Yeah.
Value and
value in volume. Because right now, most of the healthcare systems are functioning on what we call a volume-based program. And that is, the more patients you see, the more money you generate, the more tests you order, the more you generate money for whoever you work for. And on the other hand, it just keeps raising healthcare costs, and insurers keep pulling back and not want to paying for things. And patients aren't very happy. You know, I mean, if you walk into your doctor's office and they have two options, one is a medicine or nothing, or surgery or nothing. Well, you know, what if you're like, I don't really want to take a medicine, or I don't want to put my baby on something for their crying. You know, is there something else I can do that might help them with their colicky symptoms, or help the patient with the chronic abdominal pain? The common things that we're seeing right now. And so the dilemma is, if you only have a couple tools in the toolbox, your value of your visit isn't great. On the other hand, your only way to keep the healthcare system working right now is a volume-based system where you see patients and you keep helping them and going through things. So what if we can improve that value? What if every time a patient comes in, there's a better value to the visit? It doesn't have to be a 90-minute or a 2-hour visit every time you walk in. But what if you can get people to understand that there's more out there. There's things that your provider can offer you that can help you. Because patients aren't always looking for a medicine. They always say, well, some people want medicines. I'm like, no, what they want is a treatment. They want something that will work for them. And so my point is, well, give them something else. Give them something that's been proven to be effective, that helps. And let me just, if I could, just talk about headaches, for example.
Yes. It's a good one.
There's 5 primary triggers for headaches. Number 1 is stress, okay, and there's national studies looking at this.
Absolutely.
Okay, stress is number 1. Number 2 is the foods that you eat, and 2 and 3 are almost the same numbers, and 3 is sleep disturbances. 4 is dehydration, and 5 are musculoskeletal issues, so pain from your neck and your back and what have you. There are really no medicines that treat stress very well, and there's nothing that treats what you're eating very well from a medicine standpoint. There's not very much that helps you with your sleep from a medication standpoint. And so why are we not telling patients, well, why don't we start with the following? Here's some stress reduction techniques you can use. Here's someone that you can go to get manipulation that will be covered under your insurance to help with your pain. What are you drinking every day? Are you getting enough fluids in? Because a lot of times there's restrictions in schools as far as water bottles and what have you. What are you eating every day? Are you eating a high glycemic load, very starchy foods? Are you sleeping well at night? Is your phone next to your bed going off all night long like most teenagers is, that's impacting their sleep? If those are all happening, you don't need an MRI, okay, and you don't need to be put on Neurontin or gabapentin or Topamax or any of these other things. What you need is someone to address those issues. And if we as a society and a healthcare society can say, listen, before I'm going to do all of that, why don't we take care of these things, okay? And start with the treatment options and these are proven to work. And if you say this works, then let's do it. Unfortunately, in our current system, it's medicine or nothing, and we have to get past that.
So getting past that would be by having, I think, the providers taking the responsibility to learn about all of these different things. But when you think of that, there are so many things that are added to their plates and so many things that they're doing. Their life, in a sense, would benefit too from knowing and experiencing some of these things to help them with their own stress that they have. So you wonder if we provide opportunities related to education and conferences to have them
Yes.
experience different things. And some providers are more receptive to learning it than
Correct.
others, as well as some administrators are more receptive to integrating and
Correct.
using it than
Correct.
others. So how do we make this 180-degree turn
Yeah.
to be able to get it in? It's almost that, wouldn't it be great in each office or in
Yeah.
each area there was someone who was well equipped in the knowledge of the different things and was part of the team, and being able to say, okay, if we look at this as a team approach, and let's say if headaches is the thing that's coming through here as
Yeah.
a need, why don't we look at a little bit of meditation or guided imagery or
Right.
some breath work
Right.
or yoga or some energy work to help them?
Yeah, and well, I think I completely agree with you. And so how do we get there? And somebody once said this to me, and I love the concept. You know, they say, well, instead of having a revolution,
Right.
we probably need an evolution.
Correct.
And really that's what it's about, because in order, and I think this is, you hear doctors say this all the time, we have a foot in two different canoes.
Exactly.
And so, you know,
And they're balancing,
and you're
trying to balance.
trying to balance this all out.
Yes.
And they feel like they can't go either direction, or
Right.
everything's just going to come tumbling down.
Exactly.
You know, the way I view it, and well, the other thought is it just costs too much to have an office that has an acupuncturist in it or whatever. There's tons and tons and tons of resources out there.
Yes.
It doesn't have to be that expensive. And I use the example for acupuncture because there's community acupuncture programs that are donation-based that are wonderful for most acupuncture that people need. Osteopathic manipulation is typically covered under insurances, including Medicaid, so that you can actually get treatments that if you can't afford to go to a massage person or something of that nature.
And some of the employee benefits programs are
exactly.
covering the energy work, the yogas,
Correct.
and the other different
Correct.
things. And so one of the things that people can do also, as they're informing their insurance carriers to include this in it, is also their employee benefits
Correct.
programs to
Correct.
say, include this type of thing in so that I
Yes.
can take my card and use it for that, and it will make me healthier, a better employee, and
Exactly.
have a better lifestyle.
Well, and I think, and so that to get to that next step really does require education.
It does.
And, you know, Dr. Weil went out and decided a long time ago, he said, you know, we need to change medicine, and he created the fellowship. It's impractical to think that every single doctor or nurse practitioner or whatever can do a 2-year fellowship
Exactly.
because it's very time consuming and it's expensive. On the other hand, there are ways to put together within healthcare systems simple, straightforward educational pieces with good resources so people can have them so that they can actually do this within their office. It doesn't really cost any more. This is the part that bothers me, is people are like, well, I can't afford to bring an acupuncturist. Well, you don't need to bring an acupuncturist in. I can't afford to, you know, have somebody come and do manipulation in the office. You don't have to do that.
You can
refer things out.
Exactly, and know who's available to do what.
You can have handouts that help guide people.
Exactly.
You can have web-based resources that you can get things. You know, there's all kinds of less expensive ways that patients can do it. And whether docs like it or not, their patients are doing it. Right. So they either have to get on board and understand this,
right.
or they're going to be left sitting there going, wow, I didn't realize this was going on.
Right.
And there will be changes that occur, and you can either be part of it or not. And I feel very strongly about this. And you know, when I started doing this years ago, I started doing this for kids with chronic disease. Yes. And I'll take a step back because we had talked about this before. Yeah. But my goal was to bring a wellness-based approach to children with chronic illness. So as a pediatric nephrologist, I stepped back and said, geez, we're bringing this stuff into kids, you know, you're doing yoga for well kids, well, why not be doing yoga for kids with chronic illness? Exactly. We know this is going to happen. I can't predict what's going to happen to people's kidneys. Right. Most of us can't really predict outcomes of diseases. We have data that drives us and says, yeah, well, we think if you have leukemia, these are your likely outcomes, and this is going to happen. But the one thing we know with 100% certainty in every single patient and their family is it's going to stress them to the max.
Exactly.
We know it. We know it's going to have a profound impact on them emotionally.
Exactly.
We know it will have a profound impact on their family. Yes. Why are we not addressing that from day one? Exactly. Why are we not talking about this? Why are we not bringing this into their lives?
And I think that there's a responsibility to do that.
Correct.
Because you're treating the whole
Correct.
family as well as the patient, the child.
So when I started this up in Maine, I said, I want to bring this to the kids with the cystic fibrosis, and the kids with the diabetes, and the kids with kidney disease, and the kids with cardiac disease, and the kids with inflammatory bowel disease. That was my goal. It still is my goal.
Yes.
What I have found now, too, is we have this epidemic of things happening in our society. We have over 30% of kids right now are being treated for generalized anxiety disorders.
Yes.
We have tons of chronic abdominal pain and chronic headaches, and you know, anywhere between 15 and 40% rates of sleep disturbances. Things are off the chart right now, which none of the things that I'm talking about does Western medicine really address the way it's supposed to. Yes, there are medications that you can use, and I use medications all the time for anxiety and attention deficit disorder and what have you. On the other hand, that's only a piece of the puzzle.
Right, and with a child and medications, nobody really knows the effect of it from very young over through adulthood and how it's going to be or whatever.
And I do think there's times that you don't have a choice. I mean, I have
Right.
tons of patients I see with attention deficit disorder, and if they're not on medications, they can't function. They can't function in school. But let's go back and say, well, why is it attention deficit is impacting 10 to 20% of our pediatric population right now?
Now it's increased,
Why?
it's gone up. Why
Correct.
is it? Now what
Why
about
is
their
it?
environmental issues
Well, that's the
going on?
question. Is it their food they're eating? Is it the electronics they're being exposed to? I mean, we know they're probably genetically predisposed, but why is it we went from 150,000 people in the 70s to millions of children right now? We have to go back and look at that. So we can either keep using medications, which we should. If somebody needs medications, we use them.
It's an important role for them.
But let's go back to the bigger issue. What is it underneath all this that's playing a role? And how do we start addressing that early on in life so that we can do well and we can take things like attention deficit, which is actually a wonderful thing to have. It gives you the brain that allows you to think big thoughts and do amazing things in the world. And instead of getting rid of it because it doesn't fit in an obsessive compulsive world, but really making it balance in our society.
It's interesting that you say that because a lot of times, even within the schools, if someone is, diagnosed with that, it's almost viewed negatively.
Yes.
And that's, and that's an important shift that needs to be made. When you said here's this creativity and the intelligence and everything, it's because we approach everything perhaps in this way, and we need to really open the gates more.
Well, I laugh because, I commonly have parents say to me, I don't want my child labeled.
Right.
And I said, well, you're not labeled when you're in the majority. And at this point, there's going to be more kids diagnosed with something than there are kids that aren't.
They're coming up with, maybe you actually had this when you were younger, but now I'm diagnosing you with it now.
It's crazy. But getting back to it, so that what has happened in my life is I went from someone who was taking care of kids with complex medical issues and applying integrative care to that, to now looking at how do we do that in all the pediatric population and ultimately in all of the healthcare system. Because if we are going to make the changes, this is what we have to do. We have to stop creating the rift. We have to stop saying this is wrong and this is wrong and this is wrong. And we have to start seeing the commonality of health in what we do. I always say when God or the universe put a chicken on the ground, did they think it was going to look like a McNugget? Well, no. And everybody in healthcare would look and say, that's probably not good for us. So why can't we look at some of the commonality that's there and really pull it together to help it to work? Patients are looking for it. Patients are using it. Patients are finding it's beneficial to them. We have to be careful. We have to make sure it's safe. It doesn't conflict. We have to have more regulation of the things that are out there. But ultimately, we bring this together, and in the end, we deliver a healthcare system that is, to a large extent, broken. I mean, and it can't keep going. We know it can't keep continuing the way it is. It can't. There's only a finite amount of money. Companies are paying huge amounts of money out of pocket for their healthcare costs in terms of their insurers. We need to change what we're doing. How do we do that? Well, we bring health and wellness back into this.
Right.
I'm going to say there is one basic principle that underlines all of this, or runs through all of this. And that is that every patient, no matter what they have, has more wellness than they do disease.
Exactly. And our system has been focused on disease.
It's disease. It's
totally disease.
We're totally taught on how to do disease.
Correct.
And that's what we do.
And
we're
that's
not,
the biggest shift that needs to take place.
Exactly. When kids walk into my office, I look at them and I say, when you wake up in the morning, let's take a kid, let's say they have Crohn's disease, okay?
Yes.
And every time they go into the doctor, all they talk about is their Crohn's disease.
Right.
You know, how many poops are you having, and you know, are you eating, are you having belly pain, and all of are you taking your Remicade or whatever it may be.
So they're seeing the person as the disease and not as the whole individual.
Correct.
Not asking them, how is school, how is this in their life, what's going on, what are they doing?
And I always say to them, when you wake up in the morning, do your eyes see, and do your ears hear, and does your heart beat, and do your lungs breathe, and does your GI tract process your food, do your kidneys make pee, do your muscles hold you up, and does your mind think?
Yes.
So how sick are you?
Right.
Okay?
See that shift in
That
perspective.
shift has to happen.
And that same shift, it's a shift that needs to happen, I think, when you focus on what's best for the patient.
Right.
Or what's best for the client.
Right.
I think if everybody were to focus on that,
Right.
then it's easy.
It
should become easy.
And the argument everybody gives me is, I only have 10 minutes or I only have 15 minutes with the patient. And I'm like, then change what you're doing with the patient. Change your approach to the patient
as
at this
far
point.
As what you're asking.
What you're asking.
Key.
Exactly. So instead of the kid with the headaches and you're going, okay, we need to rule out a brain tumor, when the likelihood that it's a brain tumor is very low unless you find specific things, you say, well, tell me, which of the following do you have of these 5 things that could be causing your headache? And the kid goes, oh my gosh, school's been terrible, and they don't let me take a water bottle, and I skip breakfast in the morning, and there's only 10 minutes for lunch, and okay, so what's the likely cause of your headache? The patients then tell you, and then you say to them, okay, well, let's start the following modalities. All you need to do is have a basic concept of how to approach this. You don't have to be an integrative medicine fellow.
No.
You don't have to spend 20 years learning this. No. You just have to have the basics. And that's why what I look at doing, and this is what I want to do, is I want to be delivering this, have a deliverable to the practitioners, to the people who are delivering the care, so that we can change healthcare. It's just a little twist. I say that. It's a 180-degree change, but it's just a little twist. I'll give you an example. When I was doing Tai Chi, I've done Tai Chi for a number of years, and I did the same. There's a system of moves that I would do, and I've done the same system of moves for years, and I started realizing at one point that I was ending up 180 degrees. At the end of my moves, I was 180 degrees from where I was supposed to be. And I'm like, how is this happening? And I couldn't figure it out. And then I realized it was a little tiny move in my foot that was changing my angle just a little bit. And I was ending up completely the other way. And I really thought, this is what healthcare is about. It takes this little shift. It's a little twist in what we do. A little twist in the nutrition, the handouts that we give people, the things that we say to them, how we look at them. You know, I laugh. The American Academy of Pediatrics comes out with, 5210. You probably have heard this before. It's 5 fruits or vegetables, 2 hours of screen time, 1 hour of exercise, and 0 sugary drinks. So we've had this out there forever. And we have an obesity epidemic.
Huge.
Why? Because that, just putting that out there doesn't change anything.
No.
And when kids say, well, I can't eat 5 servings of fruits or vegetables a day, they don't do any. I can't do an hour of exercise, they don't do any. 2 hours isn't going to work for me, so I don't listen to it at all. What if we changed everything with the concept of healing? You look at the kids and you say, well, okay, you come downstairs, there's a bowl of fruit and a donut. Which one will heal you? Well, the fruit. why don't you eat the fruit to heal you? Not that you can't have a donut, but why don't you start thinking about your food with the healing intent?
And also being and taking responsibility for making that positive choice
And
to help
exactly.
yourself to heal.
Exactly. So there, you're using a motivational interviewing tool to
Exactly.
get them where they need to be.
And not just the child, the parent too. When you think about the system, it's just not the healthcare system that needs to make the shift. It's the schools.
Correct.
It's the family life in the
Yes.
homes. For everybody to really decide, you know, we are responsible for our own health. We know our
Yes.
bodies better than anyone does.
Yes.
And we really need to make the changes together. And the changes aren't that difficult. And the variety of modalities out there are available.
Yes.
It's a matter of being informed as to how to get them, where the excellent people that can provide these services for you,
Yes.
and to teach you the skills so that you have these tools in your pocket so that you can do it.
It's so, you know, my mom, I always tell the story. You know, my mom says I have a keen sense of the obvious, and I'm thinking this is so obvious.
It is so
How,
obvious.
I mean, I don't understand how anybody else can do it. And I always jokingly say, because I don't come from a medical background. My dad was a newspaper reporter, city editor. You know, nobody in my family at this point had gone into medicine when I went into medicine, and I was a forestry major when I was in college. And I said, I think I want to go into medicine. And my mom's response was, well, don't you have to be sort of smart for that? Okay. So I know it doesn't take someone too smart to figure this stuff out. And I can, and so when I look at this, I say, you're not only creating a way to deliver care, but you're improving that contact with the patient.
Yes.
Because how often now do people feel, you know, that that they're not connected to their healthcare system, that they're distrustful of
They
it.
feel alienated.
They feel
that it's all
from
about
it.
money,
Exactly.
and that is the bottom line, and that people
Exactly.
really don't care about them. And the tests and the decisions that are being made are not for their best interest. It's the best interest of what goes into somebody's pocket.
Exactly. There is this incredible distrust that's
There's
there.
huge distrust.
And and if people knew that practitioners were going down this road, saying, "Okay, I want to become a healer."
Right.
Okay, I don't. I say this all the time. You can be a physician, you can be a healer, or you can be a physician healer. They're not the same thing.
No.
People very often think, "Well, I'm a physician, I'm a healer." No, you're not.
Right.
There's a difference between being a scientific physician,
Right.
which is important, don't get me
Yes.
wrong,
Yeah.
and to be a healer. There's a healing nature to the things of what we do when we see patients and when we go in to
Exactly.
visit with them.
And sometimes it's physician heal thyself first.
Well, there's no question.
Because look at
Yeah,
how it got
there's
you
no
to be
question.
drawn into this field.
Yeah,
Because
yeah.
of the understanding, and if it wasn't for the fact that you became ill,
Yes,
and you didn't have the answers that you needed, that you sought out the different types of tools to help you,
yes.
which ignited your interest in wanting to bring this to other people.
Well, take a step back for a second and think about this, Yvonne. How many doctors
Yeah,
exercise
right.
and eat right, and some take supplements and herbs, and yet they turn around and say, well, and I say this to the people all the time. One of my old partners in nephrology she's like, I'm not sure I believe in all of this stuff that you do, okay? And I said, well, tell me a little bit about what you do. And she went to yoga and Pilates, and she hiked, and she was a vegetarian, and she took certain supplements every day,
Right.
and she did all these things. And I said, well, why if they don't work? And she sort of stepped back for a second and said, oh my gosh, there's an internal conflict that we sometimes grapple with this.
Yeah.
And then we step out and say, oh, wait, if I believe in this, if I see that it helps me, why am I not bringing this to my patients? Why do I feel the only thing that I have as a deliverable to them is medicine or surgery? When it's not. It's not the only deliverable.
So what would you say to all those healthcare providers out there and all those people who serve people in
Yeah.
caring for them, as far as the rationale and the importance of them
Yeah.
being aware of all of these different modalities and tools?
Well, the first thing, as I said before, one is, do you believe nutrition, exercise, and stress reduction is important in health? If you do, you're an integrative doc.
Or an
You
integrative provider,
and an
whatever
integrative provider, nurse practitioner, whatever you are,
Yeah.
nurse, social worker, whatever it is,
Right.
okay? You are an integrative provider. If you believe in that, Second is, don't be afraid to talk about it. Because the assumption is that maybe I'm going to some place that patients aren't expecting me to go. Remember, almost everybody is using something.
So it's important for them to ask the question.
Yes, it's important to ask the questions, and it's also important for them to realize that the patients want you to ask the question.
Correct, because patients want you to really get to know them so that you understand why they're feeling the way they're feeling and what's going on in their lives.
Exactly, and those types of things are the critical things that, if you can make those first two steps, great, you're started down the path. And then what you do is you step back and say, well, where's my information? I don't want to go there if I can't deliver it to them. If the patient comes to me and says, well, you know, I really am interested in taking fish oil or vitamin D. What should I take? What shouldn't I take? All of a sudden you get to a place that the docs or the nurse practitioners or whatever, or the practitioner of whatever form may be, says, I don't know how to answer that question. And then they get hesitant because they're like, well, I don't know if I should have gone down that road if I don't know the answers.
Right.
That's where it comes down to, we as a integrative society has to deliver this, have to be available and deliver that for them. And it's where we're missing right now. It's clearly where we're missing, because we've done our educational programs as if we are a separate thing from the rest of the world, and we can't be. We cannot be. We have got to realize that we need to join with the rest of the community. And I tend to be sort of controversial when I talk, because I'm not one of these people that just says everything alternative or integrative is okay. I don't believe that. I think you need to have data and you need to have information.
Well, it's the same with the fact not every doctor is the best doctor you can go to.
Correct.
Or anybody in any field is the best. What you need to do is learn about them, their training, their skills, their standards, because the objective here is to make sure that people are going to the best possible people that they can go to.
That's right.
To achieve the best possible care.
That's right.
And not people that are just saying certain things but actually don't have the credentials behind them or the information or the experience.
And my job in this is to be the person, and to help create the system whereby people have access to these tools.
Yes.
So like when I started here in Manchester, I mean, the first thing I did was I looked at all of the state of New Hampshire. So I looked at all the different practitioners that were, and who was in different areas, everything from acupuncturists and chiropractors and naturopaths and supplement places and all of the things that were there. And I looked to see, well, what is available to me out there? What is it that we can, so that we can create a network of people and people that we trust. And in kids, you have to be particularly careful, because if somebody doesn't know how to deal with children or doesn't take care of children, the worst thing you can do is send a child, well, I shouldn't say the worst thing, but not a good thing to do is to send a child to an acupuncturist who doesn't deal with children.
Right.
It's not going to go well. It's not going to go well. And you start pulling out needles going, here we come, that's not going to work.
No.
Same with even using osteopathic manipulation or whatever. You need to make sure you have that network together.
So what would you tell it, if we were doing kind of a summary, what would you want to communicate to providers first about the most important things for them to become more aware and involved with education related to this whole integrative approach?
Great. It's a great question. And I think there's sort of two or three different ways to do it. First thing you have to do is you have to open your mind. Okay, open your mind and say,
And that's a choice, right?
Yes, that's a choice. And how am I going to deliver this? Okay, so you open your mind. The hard part to this is if you open your mind and you recognize it, it's hard to go back.
Right.
Because it's very hard to go back.
Once you open that door to that communication, that awareness,
it's
and
very
understanding.
hard to go back.
Yes.
So you open your mind and you do this. And then you say, well, how do I get the information? How can I find out more about this? There's ways to do it. One, you can contact people like me. You can say, okay, Matt does this and he's been doing it for a long time, and he does it in kids, he does it in some adults. And so I can contact him and see what he has for his resources in various places.
Yeah, I'm very helpful for people with that too, which is helpful.
Yes.
Go ahead, what else?
Second is they can look around for very specific sites that are known to be good for integrative care. So like the University of Arizona
Yes.
and the work that they have, Dr. Weil's work that he has.
Yes.
The University of Wisconsin has a wonderful website that has tons of handouts and sheets and information.
Excellent.
And it comes out of an academic institution that you can get a lot of good information
This
on that.
University of Arizona? did you say?
University of Wisconsin is
Yeah.
the other one.
Okay.
So there's certain sites that you can go to that you can get tons and tons of information from.
Very good.
So I tell them you can look for that. You can look for courses like the one that we're going to offer
Yes.
that is looking at integrating and improving the healthcare system.
Exactly.
And go to them for a day. We up at the Elliott offered a full day pediatric CME. We've done it for 4 years. People can come out, all different types of practitioners can come out, spend the day, learn about the different modalities, learn about what's available,
Right.
how to treat different conditions, that type of thing. You have to, the hard part to this is there's so much out there right now. There's so much on the internet
Right.
that people can go to. And sometimes it's not the right information, or it's part of that separation that is occurring that I talk about, where somebody says, well, you come to me and I'm going to fix your kid's autism or whatever it may be, and people start migrating down that way and they read testimonials and they get like, and so it creates that rift.
Right.
You really want to look at programs, you want to see people who are actually practicing it,
Right.
okay? This is my other big pet peeve.
Yes.
Again, I'll be somewhat controversial on this, but a lot of people in academic settings are writing tons and tons of articles and books
And have
who
had no
then
direct
have
experience
no direct
whatsoever.
contact. You want to have somebody that every day is in there with patients,
We
or
have
every
2
day.
minutes, less than 2 minutes to go. What else
You're
would
kidding.
you like to
Oh
say?
my
I
gosh.
know.
Oh my gosh,
Yes,
this went by so fast.
It did. So from
So,
a perspective,
yeah.
so what I'm hearing you say is healthcare practitioners from all levels and people who care about and serve people have
Yes.
a variety of ways that they can learn the tools to know how to best serve their clients and their patients.
Correct. So a few ways to go at it. You can go look at places like the University of Arizona's website. You can contact people like myself who've
Yeah.
done the training in this.
Absolutely.
You can go to the NIH has the National Center for Integrative Health. They've changed the
Integrative Health,
name of
yes,
it.
they have.
You can. Those are some of the big places you can go.
Yep.
For practitioners, just open your mind up.
Absolutely.
Think
and
about
for
it.
patients,
And for patients,
advocate for your health and well-being.
Advocate for
with
yourself.
your health insurance.
Correct.
Advocate with your employee
Correct.
benefits programs. Ask your physicians questions, and truly make proactive decisions.
Exactly.
Seize your life.
Yeah.
Be proactive, and
Yes.
know that the power to heal is within you.
Correct.
And you can make the most important choices in your life to help yourself with your health and well-being.
that is exactly
Which is
right.
exactly it, from eating
Yeah.
to sleeping well, to exercising, to drinking plenty of water, to being mindful related to your choices and the decisions that you do, and to realize that life is short and that you can make the positive choices to be better, and you can team with your healthcare providers.
That's right.
To really help and communicate with them as to what you're looking for.
That's right.
And if you're looking for other ways to help you in your healing modalities than what they're saying, ask them. Ask them, what else is out there? What else can I do? Where do I go? Who can I go to?
Your healthcare providers and their administrators.
Exactly.
Get it through to them that this is what
This
you
is
want.
important. Well, we thank you so much for joining us. Thank you for being with us.
Great.
Until next time, take care.
Bye.
The preceding program